should mention this to Sudan.
Where he is? Every year we tell everybody we are so happy because Farhan is helping.
إذا بدك تعطيني مثلا كارتك.
It's important, even the use of the different protocol is important, because if we use the same protocol even to study angiomas, we could have some kind of pitfalls. Second message, remember that EOE is an integrated vascular and hepatocellular imaging that provides a comparing morphological and functional liver detection, and we can have we can study the hepatobiliary phase here because it reflects OATP and is enabled in the early detection of hepatocarcinogenesis due to the reduce of arterial flow. Increasing role in lesion characterization, but we need to remember that there are a very wide liver aspects, so it's important to consider every sequences, even if you weighted T1 in an opposite file to evaluate the presence of fat, everything to make the correct diagnosis. And contrast is a
This is another tool that we use, the BrainH2, another cognitive platform, and why we use BrainH2 and non-luminosity, for example. We will give you the answer to this. We have more research that BrainH2 can help long-term cognitive functions. Can you see his training? This is what we receive in the back office. Every day he was training significantly amount of time in order to help his neurons to make new connections. So the cognitive training definitely helped to improve his cognitive performance and mostly to bring his memory within the average. These are some of his comments. Objectively he improved. Subjectively also he was feeling more confident with his everyday life functionality. And this is the keynote. It's not only doing an intervention, but trying to create healthy lifestyle habits. Habits that our clients can take with them even after the end of the treatment. This was my recommendation regarding his care plan. Cognitive training is something that after the age of 60 we need to start and we have to continue, and only to come back if there is any traumatic change. Closing and finishing my presentation, I'm going back to the statements that I had in the beginning. Forgetfulness is part of normal aging, and it's something normal. It's something that we expect to happen. The difference start, the problems start, the challenges start when the forgetfulness, the cognitive decline starts to impact our everyday functionality. Dementia is not part of aging. We don't expect that if we keep aging, we will all have dementia. No, this is not the case. And after what I presented, I'm sure that you can understand what I'm talking about. MCI leads to dementia. No, we just show that there is a percentage that if we intervene, we can be done to prevent or slow down dementia. No, we show many techniques, many ways that we can help our brain.
However, injector, we need to have a certain protocol because again, we have a battery and some of those batteries are lithium, so it need to be in certain situation. The ideal vaccine need to be best for patient comfort, need to be best for global access, and need to be precisely the dose for the patient, not more, not less. This is just to show you that the growth of vaccination market is growing, and this year is expected to be $17 billion, and it will have annual growth of 10% for the next few years. So what the market want? The market, obviously, if you see the dark blue, the market want the needle-free and painless-free and more accessible to the patient. So this is what the market understands. This is where the pharma and the research lab working together to have more painless and more accessible to the population. So why everyone is going for this? If you work as infectious disease or occupational medicine or probably family medicine, you'll see a lot of needle stick injury. So we will eliminate needle stick injury, at least from vaccination, if we have a needleless vaccine. Now we are in the era of patient-centric. So whatever patient wants, we have to give him. So whether he wants an IV antibiotic in hospital or he wants an IV antibiotic in home as OPAD, we have to give it. So because patient is first, and patient wants painless solution. We are also in an era with home health care as taking lead in everywhere.